Welcome everyone to tonight's graduate student town hall on COVID-19 and conduct and student support and care. For those of you who don't know me, my name is Ellise Moon. I am a PhD student in linguistics and philosophy. I'm also the Grad Student Association President for Art Sciences and Engineering and one of the moderators for tonight's town hall. I highly encourage you to go ahead and use the Q&A feature in the Zoom call to submit any questions that you have. We've already received a number of questions from students, and we'll first introduce our panelists and give them a chance to speak, and then we will start with the questions we've received, but we would love go ahead and send in those questions. We do ask that you can try to keep those but we're always happy to answer any other questions that you have. You can email any of us or any other grad student representatives in your school or department. So I'm going to turn it over to Zach, who is the other student moderator for this panel, and he's going to introduce our panelists.
Hey everybody, my name is Zach Brehm. I'm here representing Graduate Student Society over on the medical campus. Before we get everything kicked off, I just wanted to introduce all of our panelists. So first up we have Dr. Ralph Manchester, who is the Vice Provost and Director of University Health Services. Then we have Kyle Orton, who is here representing as the University Judicial Officer. We have Ravi Shankar, who is the Assistant Vice Provost and Director of the International Services Office. And then we also have Melissa Sturge-Apple, who is here as the Vice Provost for Graduate Education. So Melissa, would you like to say any few words to kick us off here?
Sure, I just want to welcome everybody. So as the Vice Provost of Graduate Education, my office is charged with the coordination and oversight of all of the graduate programs across the 7 different schools at the University of Rochester. In that role, I provide support and coordination to student affairs, which is one of the reasons why we're coming to you tonight together for this, in order to provide information on this to graduate students. So I'm happy to be here. I'm thankful to Zach and Ellise for moderating this panel and providing this information to all of our graduate students at the U of R. Thank you.
Next would Ravi. Would you like to say a few words too? I think you're muted, Ravi.
Sorry. Thank you, Zach and Ellise. So I'm the Assistant Vice Provost and Director of the International Services Office, but I also co-chair the Campus Climate Committee for the coronavirus restart. So just very briefly, the current committee is charged to ensure that students' ongoing basic physical, mental, and spiritual needs are met equitably across all divisions. And we try to do this making sure that there's a campus culture of inclusivity and respect. And just as a brief background, it's interesting, the Campus Climate and Care Committee was first constituted when the coronavirus was first starting, that we sort of had heard about when it impacted China. And our main concern was, how do we support our Chinese students and scholars on campus? And within a matter of weeks, I think the entire committee sort of moved into a response team, which was sort of aligned with the coronavirus university response team. And as we've gone through the spring and the early part of summer, we are now focusing on the restart and how do we support students who are now back on campus. So just as a brief background.
Great, thank you very much. Kyle, would you like to also weigh in here?
Yeah, definitely. I'm glad to be here, and I'm actually going to share a slide deck to help. All right, so my name is Kyle Orton. I am the University Judicial Officer. I have the privilege of overseeing all of the student conduct for the university. That includes graduate students, undergraduate students, and the like. We have one spot for the university student code of conduct, and the goal for that is that there's consistency, which we'll talk about later, but it also gives all university students a place to reach out if they need support when it comes to student conduct. COVID accentuated that and showed that the resource was there, and hopefully by the end of this, you'll see that this fits for all of you. I did put the website there. It does say the college, I know. It's just the landing spot, but we are a university-wide office. So really the UR commitment that hopefully you all have read and have committed to isn't just a campaign. There's a lot that went into this to try to get across rules and policies in a way that brings the university together and looks at it from a public health standpoint, instead of that you must do this, you must do this, you shouldn't do this, because that's not how we're going to do this together. We're not going to protect the hive by creating policies. We're going to do it by everyone getting on board. We did it really in 5 areas: testing and screening and tracing, which Dr. Manchester is going to focus on, masking, distancing, and hygiene. Again, this comes up a lot when people talk about the conduct on the university campus, and being on campus, at least the River campus today. I was very impressed with what I saw and have heard good things, which we'll talk about. Limitations on travel, trying to get people to see that for right now, the goal is to stay around Rochester and really stay close to home to try to prevent the spread that we might be seeing at other institutions, even in New York State. And then restricting guests and gatherings on River campus, in graduate and family housing, which this applies to as well, and really reducing the opportunity that people might think, let's have a bunch of people over to our house, because you never know where that spread would lead. And then we really take into account accountability, which is my role, but it's everyone's role, is to keep and hold our community accountable. I want to focus on 2 pieces, really: the anticipated violations and consequences. And the first piece of that, anticipated, is cool to think we're 2 weeks from doing this this town hall for the undergraduate students, and we really talked about anticipated, but now I can report more on what we're seeing, and it's good news. So we did it. We anticipated the guest and visitor policy would be a tough thing for students, grad students, undergraduate students, for all community members. And for the most part, our community is following that and understand that that's how we're going to prevent keeping our campus safe, or not prevent it, but create that safe community. Mask and physical distancing, knowing when you're outside, you're away from people, it's okay to take your mask off. You can be around on your own, but when you get within 6 feet of other people and you're not eating, you really need to wear your mask. And knowing that it's an important piece. When you're inside, wearing your mask is the only way, and Dr. Manchester talks about this all the time, it's really the safest way to prevent spread. This was a big one. I was really interested in this, and we're a couple weeks in, the class is starting just a week ago, but it's all students and faculty and staff learning the campus again, or for new members of the community, learning a different campus that they wouldn't normally have if it was last year, and using conference rooms, using eating areas, outside areas, using them correctly, and then the incorrect ones is the ones we thought we'd have to correct, but I think that it's going pretty well. And then the one that honestly, many people are fearful. When you hear about outbreaks at other campuses, they're talking about off-campus events, gatherings in organization houses and just regular people's houses, grad housing, things like that. It's happening all over. So limiting the size of your events, just having a friend or 2 over when you're off campus to really keep our campus safe. Consequences, quickly about this. If you look at the chart, the top piece before the blue arrow, these are the sanctions we've been using for years, and they're effective in limiting and being educational about the normal code of conduct. When it comes to COVID, though, we had to ramp it up a little bit in using the higher level sanctions. A probation means something to an undergraduate student as well as a graduate student. It is a mark on their conduct record, which means it is an official violation on their conduct. And for those undergraduate students that you might be working with and working around, or supporting as TAs or assistants or teachers, for them, that's a big deal. They want to be graduate students someday, and they're trying to make sure that their conduct record stays clear. So as we hit the blue arrow and down, things get more severe, and we've had to really use we haven't had to get into suspensions and expulsions, but restricting access to campus and deferred sanctions, such as any other violations, would remove that student as needed. This is where the reporting spot comes in. This has been so key. As of today, we have over 150 referrals that have come in from the community, you included, that says, something's going on campus and I'd like somebody to look into this. And our office follows up with all of them, or at least gets the report to the appropriate place so we can follow up with that. So if you're filling this out, give as much detail as you possibly can so that we can talk specifics with an individual who might not know the rules or might not be following them intentionally, so we can check on that. But you'll see all the explanations for filling that out when you get to the rochester.edu/care. And then my last 4 things to remember. Consistency and fairness. If we're going to have an accountable campus, we need to be consistent and fair. We don't need to make examples of people, but we need to educate and prevent issues from continuing so our campus can stay safe. And we do that through consistency and a clear understanding of the rules. Treatment of those doing their job. There's a lot of people walking around campus, walking through halls, buildings, grad housing, faculty, staff that are maybe ask you to check your Dr. Chatbot or ask you to put on your mask. They're doing that to keep you safe and keep everyone safe. So respect for that and being part of that solution as well. COVID violations plus another. There may be people that violate a mask policy or maybe going into someone else's room and they're not supposed to, but maybe they're also drinking alcohol. We know that lowers the inhibitions. It causes people to do things such as not wear a mask, go to larger gatherings. So we're really going to look at how do we sanction those people appropriately so that those instances are not happening. And then this is I think what I'm hearing from the majority of those referrals that we get is that this isn't a case where there's just a few people that are worried that no one's going to do the right thing. The campus is worried that we're not going to do the right thing. And so we all need to engage and do the right thing. We need to take the fear that maybe our peers have and use that to do the right thing and help other people. So we all need to be part of that solution, keep the campus safe. I'm going to stop sharing. I think that's my piece. I look forward to the questions.
Great, thanks, Kyle. And finally, I would just like to give Dr. Manchester a chance to introduce himself and say a few words as well.
Sure, thanks. So as the other panelists have been saying, the success that we have in getting through the fall semester to Thanksgiving, at which point the plan is for everything to go to online, is going to depend on the decisions that everyone on campus makes. Undergraduate students, graduate students, faculty, staff, even the few visitors we have. And the University Health Service has been working with everyone else in the university all summer to prepare for this. And as Kyle was saying, the part that we have a major role to play in is the testing, tracing, quarantine, and isolation components. So we have already tested over 3,500 undergraduate students who have moved into residence halls. And the good news there is that only 5 tested positive. So that's close to a 0.1% positive test rate. And I think that reflects the good decisions that those students made prior to arriving on campus, and hopefully indicates that good decisions will continue to be made. We prioritized that group because of the group living circumstances of being in a residence hall and having shared bathrooms for the students who are in doubles, having a roommate and spending hours, presumably every night, with both roommates asleep, unable to keep a mask on during that time. So we wanted to make that the first group we tested. We have now moved on to making testing available to any off-campus student, and that would include essentially all graduate students, in addition to the off-campus undergraduate students. This is available at no cost to you, as it was to the students we've tested so far. We are using the state-of-the-art PCR test that the Strong Memorial Hospital microbiology lab is running for us. It does involve a nasal swab procedure, which is not the most pleasant thing that will happen to you all day, but it is not painful. And it's about 10 or 15 seconds on each side of the nose and you're done. If you don't produce a tear or two, we probably didn't do it quite long enough, but that's the worst part of it. So we've got time set up to make this testing available to you this week, next week. It'll go through September 18th. You should have all received the @Rochester email that gave you instructions for how to sign up for it. We do need you to actually email one of our staff, Linda Dudman, to choose a time to come in. We do need you to do the Dr. Chatbot symptom survey before you come in, and preferably do it on your phone so that you can show us the green check mark screen that you'll get when you finish answering all the questions and you're cleared to be on campus. You should be doing that every day you're going to be on campus. That's another way that we're really depending on to identify anyone who may have symptoms due to COVID, get them in for testing as well. And again, we can do that right here in the University Health Service, again, using this PCR state-of-the-art test, very low false positive and false negative rates. So we do want you to be filling out Dr. Chatbot every day, and we're going to ask you to show us the green check mark if you come in for testing. So once we see the numbers of off-campus students who are asking to be tested drop, and frankly, they haven't been very high so far. We had only about 20 students today who've requested testing and were given appointments for today. We're going to shift into what we call surveillance testing, and this is going to be for both the on-campus and off-campus students. So every week, we're going to randomly select 200 on-campus and 200 off-campus students to come in to be tested when you're not having any symptoms. If you're having symptoms, then we need to evaluate you and we may need to do a test based on that. But this is students who aren't having symptoms, because the research tells us that about 40% of people, especially in a young adult population, when they have the SARS-CoV-2 viral infection, don't have any symptoms. And then there's another group that are contagious for a few days before they develop symptoms. So we want to identify who has, we want to identify the likelihood that we're seeing an increasing number of infections so that we can take steps to protect the whole community before it gets to the level where we meet the state requirement that we go to totally online instruction. So each week we'll be randomly selecting students, sending an email saying you've been selected for testing. If there's an excellent reason why you can't be tested the next day, which is typically the time frame we're looking at, we can do it on another day. But we do need everyone's participation in this to get an accurate picture of the disease burden on campus. So that'll continue into November. The CURT, Coronavirus University Restart team, is going to be looking at these numbers on an ongoing basis. And if necessary, we can take steps to decrease spread on campus and allow us to get through to Thanksgiving with continuing on-campus, in-person instruction, we hope. The other thing I've been asked to talk a little about is what happens if you do test positive, whether it's because you're feeling ill and we had you come in and did a test, or because you were selected randomly and your test turned out positive. There are two steps that happen, and currently they are both being handled by the Monroe County Health Department. So if you test positive, within 24 hours, you should get a call from someone at the Monroe County Health Department who will identify him or herself and explain that they're calling because they were notified that you tested positive, and this is all part of the public health approach to controlling the pandemic. The county health department just automatically gets notified when somebody has a positive test. It goes right from the microbiology lab to the county health department. So they will call you and interview you over the phone to find out who you've been in contact with during the period when you've been contagious, which is typically about 2 days before you develop symptoms or 2 days before you tested positive. The definition of a contact is being within 6 feet of someone for 15 minutes or more in a row when either person is not wearing a mask. So this is why we want everyone to be wearing masks all the time that you're indoors, unless you're eating, and all the time that you're outdoors if you're within 6 feet of anyone, because if we all are, then there will be virtually no significant contacts that require you to go into quarantine. So if you test positive, you have the infection, then you need to be in isolation for 10 days, usually. It could go longer. It's typically a minimum of 10 days. We have space in Whipple Park where we can have people spend their isolation time. If you've been around someone who is infected, and it turns out through the case investigation and then the contact tracing process that you were within 6 feet of that person for 15 minutes in a row and either one of you was not wearing a mask during that time, then you need to go into quarantine for 14 days since your last exposure to that person. And I know it's a bit upside down to say isolation is 10 days when they're really infected and quarantine is 14 days when you don't know if you're infected. You might not turn out to be, but that's the way the virus works, and that's what we have to do. So if you need to go into quarantine, the county health department notifies the university health service. We get in touch with you and arrange for you to be in quarantine. Again, we have quarantine space in Whipple Park. We have additional quarantine space available in some hotels in Rochester if necessary. There will be arrangements for you to get food, have Wi-Fi access, etc. So that's basically how the whole process works if someone tests positive, both for that person who's infected and for the people that they've had significant contact with who've been exposed to the infection. So with that, I'll turn it back over to our moderators.
All right, thank you very much. I think with that, we're going to get to some of these student questions that have been submitted to us. So I'm going to turn it over to Ellise to ask our first question. But if you have any further questions as we're going through this, please feel free to add them to the Q&A below.
Cool. So the first question we got is probably best for Dr. Manchester to answer. And that is that on the River campus, they're reporting the number of positive COVID cases, which is currently at 5. But will the number of positive COVID cases also be reported for the medical center campus?
The medical center is using a different process to track and report their infections because of it being a healthcare facility. They are more affected by the HIPAA regulations that have tighter controls on releasing information like that. So I don't believe you'll find a public website that provides a count on a day by day or week by week basis. I can tell you in general terms that they do keep track of that very closely. And when they tested the faculty and staff in the hospital using the blood test that detects antibodies, the percentage of hospital faculty and staff who tested positive was actually lower than the rate in the Rochester community. So even though many of the staff there are dealing with coronavirus patients every day, and everyone is dealing with patients there, and you don't know who's infected and who's not, because of their very consistent use of personal protective equipment, they are actually better protected than people who are just in the community and might not be wearing masks as consistently as they should.
All right, well, thank you for that. We have another question for you while we have you. We were wondering, will there be any restrictions placed on graduate students who are hoping to travel home for the holidays? Considering that we're going to have to be dealing with Thanksgiving coming up in the next few months, it might be relevant to a few people.
Sure, and we've got Labor Day weekend coming up, and we've got Jewish High Holy Days coming up, and so there will be opportunities for or reasons why people would want to travel, and some people need to go home for healthcare, for family emergencies, major family events, things like this. The basic message we want to get out is that in order to keep all of us safe, we need to minimize the number of trips that all of us take going away from campus, because even though the infection rate in New York State is very low now, there are still ongoing infections that are occurring every day. Still, hundreds of people test positive in New York State, but that's because we're doing tens of thousands of tests every day in New York State. So we do want to have students stay on or very close to campus. There is a mechanism that has been set up for students who have a specific reason to travel more than 100 miles away from campus to check with their dean's office to get at least some feedback on the appropriateness of that travel, and to make arrangements for being safe when they get back. Now, that's all assuming that the travel is not going to one of the states on the restricted list. If anyone has to go to one of those states, and there are 30-something states on the list right now, or going to any other country, then there is a New York State mandated 14-day quarantine when you return. And that's not something the university has any control over. That is a state of New York requirement. We've got a number of students right now in quarantine, having arrived from one of these restricted states or another country to begin the semester. And we have support mechanisms in place for them, but there is no getting around it. It is a New York State requirement. So we want you to think very carefully about travel. Obviously, there are more dangerous and less dangerous places to go, but if it's going to be more than 100 miles away from Rochester, the policy is that you need to contact your dean's office and get a plan in place for doing that.
Thank you. So the next question that we have is for Ravi, which is what sort of support will the university be able to provide for students who need to quarantine off campus?
Thank you, Ellise. There are a number of, I think, resources that you can tap into. And I should say that the composition of the Climate and Care Committee, which is a university-wide representation, is drawn from all the different schools and different, different units, within the university. So one of the things that we've done, I think, very consciously is to make sure that any resources that we have is applicable to all students, undergraduate and graduate students. So I think if you have to quarantine or isolate in your apartment, one of the first things I would say is that, depending upon your circumstances, you can actually put in a care referral to provide support. Now, before I even, but let me sort of backtrack a bit. Each graduate school has a quarantine and isolation coordinator that's been identified, and you can find the contact listing on the university's COVID-19 website. And Katie, I'm not sure if you can put that link up in the chat so that people can see where that link is. You can go directly to the COVID-19 website and see who your contacts are within each of your schools. So if you are in quarantine and isolation and you need services, you may contact that person directly, who can then get you connected with, with the care network. Also, you have direct access to the University Counseling Center for any kind of telemental health needs that you may have. And even if you're not in quarantine and isolation, if you are, I think, anxious or feeling unsafe, you may contact the UCC telemental health office. Beyond that, you also have access to the food pantry. So if there is any kind of food insecurities that you may be facing, or if there are any financial resources that you may need, you can go directly to the food pantry by going to the link. And also, if there are financial resources that you're in need of, you can go to the Basic Needs Hub and complete a form, and the Basic Needs Hub will then evaluate your circumstances and then be able to award you financial help to sort of get you through to whatever period of time you may need. But in general, I think you have a lot of wraparound service, and particularly, I think you should also know that if you have a need, you can also purchase the dining commuting plan through the university, where you can do it on a declining basis, so you have access to all the dining facilities on campus if you need. But if you're in quarantine isolation, obviously you can't. But then you can also then order food through Grubhub or Instacart or other delivery services. But once again, if it's a financial issue, you can always complete your request of the Basic Needs Hub, who will be able to help you out. So there are plenty of resources, and we say, take advantage of it. But I would say for graduate students, start with your quarantine and isolation care coordinators within each of your schools to get any help and assistance that you may need.
Great, thank you very much. Now we have a question for Melissa. So a number of students are working and not really needing to be on premises of the university in order to get this work done. So what should students do if they feel like they're being pressured by mentors or principal or PIs to come in and work on a campus when it's not really necessary?
That's a good question. So I think the university take on all of this is we're trying to de-densify campus as much as possible. And so anything that can be done remotely really should be done remotely as much as we can. Understanding that there are obviously limitations around that and subject to some of the discretion by, faculty advisors and classroom teaching. Also, we're trying to do that obviously in person. So the other thing outside of that, really suggesting and pushing that should be done remotely. If it can be, I would say if a student has concerns about that, and that's understandable, they should obviously probably talk to their dean of their school. The other alternative is the link that Kyle put up, and maybe Katie, you can put that in the chat again. So the referral that Kyle referred to, that's up on the web, it's a COVID-related concern. And that's also important for graduate students, I think, because sometimes you might not want someone in your own department to answer this. So this goes directly to the university, to Kyle's office, and to a university centralized system that kind of gets referred out. So that might be a way that students, if you are uncomfortable about something and want to have someone look into it, a way to potentially refer it. And that also includes faculty, if there's concerns you have about faculty or staff or vice provosts, administrators. So this is a way for students to have an ability to kind of report something outside that sits outside of their own school. So.
And if I could just add, if you're concerned about coming on campus due to a personal health condition, you can work through the university health service to address that as well. And that can keep your health condition confidential, but we can be an advocate for you to protect yourself while still doing what you need to do in your job and or pursuing your degree.
And if I can quickly add, I think in addition to that, you also have access to the care network. So I think if you're feeling pressure, and I think you always do a self-referral to the care network when there will, or you also have advocates through the care network as well.
Thank you all for those answers. Another question for Melissa is, how does the university decide whether small graduate classes can be conducted in person? And is there a chance of more classes being conducted in person if our numbers remain stable?
Good question. So I think a lot of those decisions are governed by state mandates that come down in terms of number of people that can be in a room. And Ralph, Dr. Manchester knows well, we've been through many calculations of that across campus. There actually should be outside rooms posted, the occupancy limits in those rooms. So that's really the limitation that we're operating under. And I think once those limitations are, if they are changed or released, which the governor has done, if we think about gatherings of, that those numbers have changed, then obviously we can readjust our numbers, but we're kind of stuck with what we're at right now with what's been mandated by New York State, which is really, again, to help protect the health of everybody in the community. So we're going along with it willingly, knowing that that's kind of the goal of everybody. So, and I think if it did change, we would obviously relay that out to schools and deans, and I think they would obviously relay that out to students. So that was a possibility.
Great, thank you. So I have another question for Kyle. So as a community, how should we feel, what should we do if we feel that we're unable to address our peers about handling, social distancing guidelines, if they're not doing so correctly? Who should we be directing those concerns to?
Yeah, so again, Katie posted in the chat, the rochester.edu/care, and you'll find the COVID incident report form, and giving us all the details you have. You have somebody in your grad class that continues to show up and doesn't have a mask on, faculty members not wearing a mask. We saw one today for contractors on campus that were doing construction and didn't have a mask on, and we work with facilities to remind the contractors. And if that doesn't work, then we'll go further. But the main thing to remember is this central spot is coming in from everybody. You know, it's an opportunity for the entire community to weigh in and say, I want this to be right. I want us to do this right. And here's why I don't think we are. So nothing is too small. Don't ever feel like you're writing something and no one's going to care, because we're going to read it and we're going to follow up and meet with the appropriate people if they're identified. And if not, sometimes it just means we have to put education into a floor or a wing or a classroom or a department, whatever we need to do to get them to see that the community really does care about what they're doing. So use that report form and we'll follow up with the appropriate people.
I have another question for you, Kyle. It's for students living off campus in their own apartment or residence. What are the sort of guidelines and policies related to gatherings, having a friend over, having family over, et cetera?
Yeah, so the university policies very much reflect what we believe the obligation we have to the community. So some of our graduate students live in the city of Rochester, which has different regulations than some of the other suburbs. For instance, after 11 p.m., if you live in the city, there are restrictions on the amount of people. They keep numbers very small, especially inside as well as outside. I believe the numbers are, I think it's 10. I'm sorry, I mix up the two. But and so when you think about what you are able to do, let's focus on that. You have the opportunity, if you're not living in graduate and family housing or any university housing, you have the opportunity to invite people into your house, but you have to keep those small. My recommendation is to do things outside. Everything for now, you know, Rochester winter is going to get us, but right now the weather's beautiful, and so try to plan some things outside. Stay connected in that way. Wear masks and find ways that you can be safe in the same sense that you always could. But as far as university policies, I think that if we get word that there's large gatherings off campus and it's on or off campus, we will follow up with the tenants of that house and have a conversation about what are they doing to protect our community and whether or not they want to be part of that community. And that is a serious conversation that we're going to have. But a lot of people are making sacrifices right now, and I quote a lot of people saying it's not the time to be selfish, it's the time to step up and help others by keeping numbers small.
Great, thank you. Dr. Manchester, we've had one question come through in the Q&A about the surveillance testing that you mentioned. Is this going to be directed just towards undergraduate students or all other students?
Yeah, the surveillance testing program is directed equally at all students. We are dividing it up into a cohort of on-campus students and a cohort of off-campus students, but that's irrespective of whether you're undergraduate or graduate. There are approximately equal numbers of on-campus and off-campus students, so every student has an equal chance of being selected for testing during the fall semester. If we do 400 a week for 12 weeks, that's 4,800 people we will ask to come in. Once we ask someone to come in, we take them off the list of future asks. So you've got over a 50% chance of being asked to come in for surveillance testing during the course of the fall semester.
We had another question come in for Dr. Manchester, and also I just like to remind people, if you have any other questions, please go ahead and submit them so that we have time to get to them. But the question is for a student who is living off campus with family or with other people, and someone else in that group tests positive, would they be expected to quarantine by themselves or quarantine with that group, and sort of what is the plan there?
Sure. So when the family member tests positive, the county health department staff will reach out to that individual. Now, if it's a child in the family, they'll call a parent, of course, and determine whether that person can really isolate appropriately in their current living facility. So if, say, It's a 2-bedroom apartment, and it's a student, another adult, and 2 kids, and one of the kids is infected. That may or may not work out so well, to have the infected child be alone in the bedroom for 10 days. Obviously, someone needs to help take care of the child, but just in terms of sharing maybe the one bathroom, things like that. So that's a determination that the county health department case investigator will help the family make. And then it will shift into contact tracing, because probably by definition, everyone in the family will have been considered a contact. And as the contact tracer calls the other family members, the same kind of discussion will take place about, can you really quarantine in your current housing? The university will help with that. If we need to help the student figure out either an isolation space or a quarantine space, we will do that. And that will be handled as we're notified by the county health department that we've had someone test positive or we've had someone turn up on the contact tracing process. So we will not just, leave you abandoned on your own to figure everything out on yourself. Ravi's group will be working on that. University Health Service will be involved, and will help us all get through this.
Great, thank you very much. So we have another question for you, but I want to just remind everybody real quick to add any other questions to the Q&A, and also make sure you're checking the chat for any of the links that are being sent out for the information that we've been discussing. So one other question, Dr. Manchester, is if you're traveling to a high-risk state and you return, is it possible to show a negative test result in order to avoid having to quarantine?
No. The requirement to quarantine is established by New York State, and there is no provision in the requirement to test instead of quarantining. And there's some scientific rationale for that, because once you've been exposed, it can take up to 14 days for you to develop the infection enough that you would test positive and then develop symptoms. So the rule is you simply have to do the 14-day quarantine. Yes, I'm aware there are other states that allow people who are coming in from, say, a higher incidence state to test in lieu of quarantine, but that is not the rule in New York State, and we must follow the New York State rules.
All right, another question for Dr. Manchester. Is UHS planning to host a flu shot clinic this year? And if so, what might that clinic look like?
We're planning on hosting a number of flu shot clinics this year because we cannot maintain social distancing moving 2,000 people through the Gergen Athletic Center Fieldhouse in one day. The line would go to, I don't know, downtown Rochester or something. So we are in the process of identifying dates and sites on campus when we can be administering a few hundred flu shots in a day rather than a few thousand. We are strongly encouraging everyone to get a flu shot this year. As I probably don't have to explain to you, with the symptoms of flu and coronavirus being almost a perfect match, you're not going to know which it is if you get sick. And we're all going to be healthier as a campus community if we can greatly reduce at least the number of influenza cases that occur. Interestingly, in the Southern Hemisphere for the last several months, they had the fewest number of influenza cases they've ever had, almost certainly because by social distancing and wearing a mask, you're also reducing the transmission of influenza virus. So all of this is going to work together to get us through the coming months with the fewest cases of respiratory viral illnesses. But we strongly urge you to get a flu shot, and there will be notices going out about when the opportunities for that will occur, probably starting late September and most of them in October. Flu season in Rochester rarely starts before November.
Great, thank you. So we've had a lot of questions answered today, so I just wanted to really quickly ask everybody for a last call for questions to be added to the Q&A here. So if you have anything that's on your mind, make sure you get it into the Q&A right away.
I think there was a question about alternative testing strategies that came in.
Well, we just have one come in right now that's about wondering if you can get a blood test to check for immunity if you've already had COVID a few months ago.
Good question. Yes, there is a blood test that will determine whether or not you have antibody to the SARS-CoV-2 virus. However, there are only limited circumstances under which your insurance will pay for it, and the university does not have a program in place to do this test at university expense, because it almost never leads to a change in what we need to do. The one exception is if you know you've had a coronavirus infection and COVID-19, and you're interested in donating plasma, then you need to have an antibody test to see if your antibody level is high enough to make that worthwhile. So if you have been tested positive for COVID-19, you've recovered, you can make an appointment in UHS and we can do an antibody test. Beyond that, there really isn't much that a COVID antibody test is going to tell us. Now, it would, if it's positive, it would say, yes, you've been infected at some time, probably in the last 3 or 4 months, although that's mostly when COVID's been around anyway. But it doesn't say that you won't get it again. And there are now a number of documented cases of people who definitely had COVID-19. They recovered from it. They had no virus in their body, and then they got infected again. So it's just not all that useful on a sort of a clinical level to say that, oh, if you've got antibody in your blood, then for the next month you don't have to wear a mask. No, that's not the way it works. And so it is a somewhat expensive test, about $100. And as I said, useful only in very limited circumstances.
I'm going to open it up if any of our panelists have any final comments, and also if anyone else has any final questions, if you want to submit those now before we wrap up.
Yeah, I'll jump in. I know my role on campus is to focus on conduct and trying to keep people safe through adjudication, but the greatest reminder we can do is that we don't keep our campus safe by holding people accountable after we do it. We keep our campus safe by following what's good for others and protecting each other. So knowing the policies is one thing, but abiding by them because you know you're part of a greater community, not just the University of Rochester campus, but the greater Rochester community. And we play such a vital part in the growth of this city and the impact it has. And certainly our city is hurting, especially today with news, and very sad to read, but more than ever, we as an institution need to step up and look out for each other. So I encourage you to understand the policies and do what's best for others.
And Ellise, if I may add, just to kind of reiterate, there's plenty of support, plenty of resources, and I think I would say, urge to make sure that you tap into those resources and those support systems to help you through, the tough times as well as the good times, I think. So.
We had another question in the Q&A. I think Dr. Manchester or anyone else can answer this. But is there a plan for the university to start implementing temperature screenings at buildings with students coming in and out, or maybe not doing chatbot?
Yeah, we have not been using temperature screenings. There's an interesting history with checking people's temperatures to determine whether they have a particular infectious disease that can cause a fever. And it's been used for a number of years, long before COVID-19 appeared. So it was used back in the first SARS outbreak. It's been used for Ebola virus and a couple others. 9 million people have been screened with temperature checks, and so far no one with the targeted disease has been identified. Now, admittedly, maybe they couldn't actually follow up on every single person who went through the airport, but you'd think with 9 million chances they'd find one. So it's just not a good way to determine whether or not someone is infected. Now you could argue, well, people can lie on Dr. Chatbot. They can say they don't have symptoms when they do. That's true, although people can also take Tylenol or ibuprofen to keep their temperature down when they're having a fever. And temperatures are not elevated all day long when someone is having a fever. It's only at certain times of the day. So they're not using temperature screenings at Strong Memorial Hospital. We are not using them here in the rest of the university either, because they don't work. Stores, yes, use them, but stores don't have medical staff available to help interpret symptom reports. And frankly, it makes it look like the store is trying to do something. But now you know they're not really accomplishing anything.
Before we end, can I just say one thing to the students that are out there also? I want to thank Zach and I want to thank Ellise for moderating this. They are your student government leaders in SMD and in AS&E, but they're also student leaders across all the schools. And if you have concerns or questions around this, these are the students that you can go to help, answer those and advocate for you up to administration and to dean. So I just want to thank you both for doing this and hosting this and being a voice for the students. So.
Thank you very much. So just one more time, I just wanted to get the call out there for some questions in the Q&A. And again, if any of our panelists have anything to wrap up with, feel free to jump in. Otherwise, I'd like to just turn it over to Ellise to say a few more words before we call it a night.
Thank you. Yeah, thank you everyone for coming. Thank you for submitting questions now or whether you did so beforehand. And definitely, as all of us have reiterated, if you have further questions, if you have individual situations that you need support with, if you have questions not related to COVID about grad student life and your grad student experience, please reach out to me. Please reach out to anyone on this panel. We would love to connect you with resources to answer your questions. It is a very difficult time for a lot of us, and I think there's a lot of loneliness and isolation that can come with just not being able to be on campus in person, not being able to see each other face to face. So definitely reach out and use your resources, and just also be a good example to other grad students around you, and share those resources with them, just so that we're supporting one another as a community.